Here's some cases. Here's Jody, who we saw about 15 years ago. What is the year on that? It says 2006. Yeah, about 15 years ago. She had psoriatic arthritis on steroids and other drugs for most of her life, in bed for 30 years, unable to move too well with her psoriatic arthritis. She made a complete recovery. I remember Jody came to one of our retreats, and we climbed a mountain together, and she went to the top of the mountain after not being physically active for most of her life, put her arms up in the air and said, "Look at me, I'm a medical miracle. I can climb mountains without psoriasis or arthritis now on no medications." You know, it's not a miracle, because it's not a medical miracle. The miracle is, and the message here, is that inherently your body is the miracle. You have a self-healing body, that these diseases are not natural. It's not natural to have psoriatic arthritis. It's natural to be healthy. It's not natural to get cancer, to get heart disease. You're taught and you're trained and you're brainwashed to think that these diseases, right? You're brainwashed to think that these diseases are genetic, the natural consequence of aging, and just bad luck, and there's nothing you can do about it except go to your doctor and let him take care of your health by giving you drugs. Isn't that what most people think? You've taken away all of your self-determination. You've taken away all of your ability to take control of your health and do the right thing. So there's Jody. Here's Chris Miller. Chris Miller is a medical doctor, living in Aspen, Colorado, who developed lupus, put on steroids and other drugs, didn't get better, had to quit her job as a doctor, couldn't work in an emergency room anymore, too sick to work, too much risk of infection to be safe for other people to be in contact with her, pretty much had to quit work. And then, after these drugs failing her and feeling so bad and losing her hair, she came to one of my immersion programs. And she was shocked by what she heard. And she changed her diet. And what do you think happened? Her lupus went away. Right, she didn't die. Her lupus went away. She's back a physician again. She's back as a functioning doctor, working again. And you know what? She just ran a race. Now she's running, skiing, enjoying her life. She got her life back on no medications. Here's Kelly with autoimmune hepatitis. At age 50, she found out she had an ALT, a liver with greater than 500. She was told by her doctors that if she didn't take high-dose steroids and other immunosuppressive drugs like Imuran, she'd need a liver transplant or be dead. Yet she refused that because she contacted me through the member center on the website and asked me if it's safe for her to try this for a while to see if she could stop not to take the steroids or the drugs. And I said to her, I don't know for sure, but let's give it at least a few weeks and see what happens. Here's what happened. There's the data. After just 3 weeks, her levels started to improve. Isn't that amazing? Just 3 weeks after told her she was going to die. You can see after April, May, or June, her levels dropped from 500 to about 250, right? They dropped in half. By September, they dropped to 100. Don't forget, normals are like below 50 or something, right? Within 1 year, her level was completely normal with no autoimmune hepatitis, made a complete recovery, and she never looked back and was never sick again a day in her life. Pretty amazing, huh? Now, what's similar to all these cases, in every case, the doctor involved with their case told them that if they didn't follow the doctor's advice and take the drugs, they would die, need transplantations, or do something radical, that this is radical and not going to work. They all were told diet didn't work. It reminds me of a case. I have to tell you a case with a bad outcome. There was a girl, a teenager. By the way, I have a teenage patient with lupus who was on the National Renal Transplant list with a creatinine of 4.2. You know what a creatinine of 4.2 means? That means you're waiting for a kidney transplant. She got her creatinine down to 0.8. She got completely well again and off the medications. Amazing, right? I wouldn't even think that would happen, but it does. So I have this person call me on the phone. Their daughter is hospitalized in a hospital in Boston. I think she was in Brigham Young Hospital in Boston. And she wanted to take the daughter out of the hospital to see me as a patient because the drugs were not working and she was continuing to deteriorate and her numbers were getting worse under conventional care. So what do you think happened? They put a policeman, the doctors involved with the case, got a court order and put a policeman in front of the room and wouldn't let the child leave the hospital or the parents control the child's care, and the doctors now had free rein to do what they want without the parents' intervention into the case. So the parents brought a lawsuit in Connecticut where they lived, and they had me travel to Connecticut to testify before the judge. It's a sad case, just to warn you in advance. And they had me testify before the judge some of my outcome with lupus patients using this approach and to show that this person was deteriorating and not getting better under conventional care. And when the judge saw the cases and reviewed my science, and he ruled in our favor to allow the child to leave the hospital and come to my clinic and see if we could help her. And I wasn't going to stop. Don't clap. The child died before she left the hospital. This was because there was such a delay of weeks and weeks of getting the child out of the hospital because the medical profession was able to keep the kid there against the parents' will. And you know what? In the hospital, they reported to me that there were multiple police officers on the floors keeping kids in the hospital against the parents' wishes because the doctors decided this was the care that was right for the children, and they weren't letting the children go out and do another type of care other than it was conventional care. You following that? You can see what just to give you an example of the type of, what I've been living with all these years. It's been a big fight. Here's April, who had severe multiple sclerosis by the age of 48. Her tongue got numb, and she lost control of her body and couldn't walk anymore. She slurred like a drunk. She couldn't control her bladder. She was diagnosed with multiple sclerosis, with lesions in her brain. And what do you think her doctors told her? They told her, if you don't take these drugs, you're going to deteriorate and be in a wheelchair the rest of life, and you're never going to get well. Did that happen? No. They were informed she was informed that diet had no impact on MS. With just 6 weeks of following this program, she got feeling back in her tongue, and she started to be able to feel and to talk normally again. The slurred speech went away. She was thrilled. That was just 6 weeks. Within 6 months, she was back to walking and feeling normal again. And now she's repaired herself, has no multiple sclerosis, no signs of it. It gradually went away. She's lean, strong, healthy, at her perfect weight. She lost 40 pounds, and she's back to enjoying a healthy life again, like so many others with multiple sclerosis. Here's Janet, who had multiple sclerosis too, had MS, lost 100 pounds. She was on steroids and other drugs, but she lost her 100 pounds, got rid of her MS, her migraines, no more high blood pressure, and back to living a normal life. And these people are so grateful, and they are the superheroes. Because think of what they had to do to achieve wellness, to go against the advice of their doctors, who always threatened them and told them this couldn't work and wouldn't work and was going to kill them, and they can't, diet doesn't work. They had to be courageous, right? But here's John, who lost 160 pounds. This is an interesting story. He's a truck driver who started dating Sarah, who was overweight with multiple sclerosis. But he was 160 pounds overweight. He weighed over 350 pounds, too. So he lost his weight, got healthy, and he started dating Sarah as he was losing weight, and he started telling her about my work because she had multiple sclerosis. And what do you think happened to Sarah? Oh, I went the wrong way. What do you think happened to her? She lost 100 pounds, got rid of her multiple sclerosis, and they got married. This is better than Bachelor in Paradise. Look at her now. Wow, amazing, huh?